Next up is Dr. Michael Cummings. Dr. Cummings is chairman of the Department of Health Behavior at the Roswell Park Cancer Institute. Dr. Cummings is widely recognized as one of the leading public health scholars in the field of tobacco control. He currently directs the operations of the New York State Smokers Quitline and the Roswell Park NIH-supported Transdisciplinary Tobacco Research Center, which is funding research efforts on evaluating the impact of global tobacco control efforts. Dr. Cummings.
Okay, thanks, Jeff, and welcome to Roswell Park. And I'm really proud to have these ads being released here today, actually, and I'm glad that the New York State Health Department asked the CDC when they applied for the funds for this award to use this to do television advertising with hard-hitting ads, because we know, we've heard from the panel, we know that these kinds of ads work. They're emotional. They're controversial, but they're also truthful. And we know from past experience that these kinds of ads actually drive smokers to pick up the phone and call our Quitline. In fact, the artery ad is one that we ran in Western New York a number of years ago. These ads have run in other countries, primarily Australia, I think was where they were developed. Cigarette companies are appealing also to people's emotions. So there's a little battle out there. We hear slogans like "Alive with Pleasure." That's not sort of appealing to one's cognitive thinking about the benefits of smoking, I think. The truth is it's death with agony, and we are in a battle for the emotions that people have, because smokers need to be shocked into taking action now. And these ads, because they will go all over New York State, will reach thousands and thousands of people who are going to sit there with their cigarette and stuff it out, or not necessarily pick up the next one. Maybe some of them will call the Quitline and get help, but many thousands of people will quit smoking because of this, and that saves us all money. It saves lives. So virtually all smokers do want to quit. And we followed thousands of smokers all over the world, and when you follow them over years, we find that, I think in our last study in New York, or in the US, 96% of smokers have made a quit attempt in just following them over about an 8-year period. That's everybody. People want to quit. They have a hard time doing it. We know that mass media is the primary driver of calls to the Quitline. Without media, people are unaware of the service, the free help that we offer, the services that we provide. And we have a busy Quitline, but it could be a lot busier. We have 2.6 million. Our goal is to get every one of them to call us. This is a journey that people go on. It's not a magic bullet when they call us necessarily to quit, but we will work with them over time so they eventually are successful. We see a direct correlation from the tobacco cessation media that's been running by New York State and the number of people who call us. When you go off the air, we don't get as many calls. When you have these kinds of ads running, we see a massive increase. In fact, last year, over 50% of the clients contacting the Quitline stated they saw the ad. So hopefully these ads not only will run on television, where we'll pay for the advertising, but we'll put them up on the internet and YouTube and Facebook and other places where people can get to see them as well. People call the Quitline when they get motivated, and you got to get in their head and get them moving and shake them up a little bit, because the grandparents and the parents and the families that walk into this institution every day see the effects of smoking. 1/3 of all cancers. I say that every time I do a press conference here. We are at Roswell Park. We want to prevent cancer. 1/3 of all cancers could be prevented if we just got people off of cigarettes. So at Roswell Park, our focus is cancer. The most effective way to prevent it is don't smoke. So we're proud that Roswell Park is the contractor for the New York State Smokers Quitline. As Dr. Willett has mentioned, the New York State Quitline is celebrating its 10th year of operation. It's a free, convenient program staffed with great quit coaches who do a wonderful job. They'll work with people. It's not just one time. We'll follow them up, keep working with them. And it's highly cost effective. Quitlines are effective. It costs about $200 for us on average to help somebody get up all our expenses and personnel and the nicotine patches and things that we give to get one person to quit smoking. You come to Roswell Park, you got lung cancer, that's $35 grand a year. I think that's a sort of cost-effective trade-off there. So, and you know, that's taxpayer dollars too, because we all end up paying for the increased health costs. So we're concerned about health care reform. We can reform it right here. Let's help our friends and neighbors quit smoking. We've received over 1.3 million calls. That's not enough. We want every smoker to give us a call, and we'll offer them help. We have the free NRT to give people. We'll educate people every time we get a chance to do it. So if you're ready to quit, you can click or call to quit for free. Tobacco users who visit nysmokefree.com can join our new tailored quit program 24/7. You can get help. It's a really great program, and I encourage people to take advantage of that. If you don't like to go online, you can call our number, 1-866-NY-QUITS. Got to give the plug for our program. And I want to thank everybody today for coming out for this great event. Thank you.
Thank you, Dr. Cummings.